Very welcome, everyone. The title of my thesis is Investigating Alternative Methods in Caries Prevention. My name is Katinka Kesjár. I'm a clinical specialist and also a first-year PhD student. I work at the Department of Restorative Dentistry and Endodontics. My supervisors are János Vág and Eszter Molnár, and my SMS is Sinitian. My vision is to create better oral health using alternative methods, and my mission is to explore new strategies in caries prevention. For the sake of this goal, I would like to introduce you my two ongoing projects. The first is investigating the effectiveness and safety of probiotics in preventing caries by using the methodology of systematic review and network meta-analysis. My second ongoing project is pretty similar, but instead of probiotics, natural and herbal oral care products will be in the center of attention. Let me tell you more about my first project. Again, the title is Investigating the Effectiveness and Safety of Probiotics in Preventing Caries. 2 billion people worldwide suffer from untreated caries of permanent dentition. If we leave a lesion untreated, it will lead to severe complications. The best way to reduce this number is not to treat more carious lesions, but to prevent the formation of decay. The etiology of caries clearly describes that bacteria are essential for decay formation. If we intervene at this point by reducing the number of bacteria, by using antibacterial agents, then we can reduce caries incidence. Every fifth person sitting in this room, so every 15–20% of the total population, belong to the high caries risk category. What does it mean? It means like for the everyday fluoride-containing toothpaste use, in addition, they need to use some extra, like it's advised to use either fluoride or chlorhexidine mouthwash to improve their oral health. What's the problem with these agents? These are effective and these are good, but a lot of people develop phobia from using fluoride because 23% of the total population in the USA is affected by dental fluorosis. That's what we can see in the picture. It's an irreversible malformation of animal due to being overexposure to fluoride at the very early age. And I want to highlight at this point that this overexposure usually comes from systematic resources. Side effects of chlorhexidine that I mentioned earlier even occur after 1 week of use. And these side effects are really uncomfortable, like taste change, tooth staining, sore mouth, and tongue irritation. And here comes probiotics in the picture, as there is an unmet need for high caries risk patients to find some home care additional treatment to their very basic gold standard fluoride containing toothpaste that's safe to use in a long term and has no restrictions in use. And probiotics can be an option as they have a long history of use and has wide indication field from food allergies to periodontal infection through halitosis. And again, I just wanted to make sure that everyone will understand that I'm not against fluoride. The gold standard is the fluoride containing toothpaste, and we are looking for an additional treatment for high caries risk patients. So my aim is to investigate if probiotics could be a safer home care treatment alternative to chlorhexidine or fluoride mouthwashes in caries prevention. My clinical question: can probiotics significantly reduce caries development? The population would be general population, and we would examine probiotics, compare it to fluoride mouthwash, chlorhexidine mouthwash, and compare it to standard of care. The primary outcome would be caries increment and salivary streptococcus mutans count. The secondary outcomes would be plaque index, gingival index, and salivary pH. My hypothesis that probiotics are non-inferior compared to chlorhexidine or fluoride mouthwashes in the term of reducing caries development. If this hypothesis turned out to be true, it will be a strong evidence what would we suggest to high caries crispation in the first line. Here you can see my search key. The first domain refers to all the interventions in the network analysis, and the second domain refers to the main outcomes. The search was conducted in 4 databases in November. And here you can see some of my key articles proving that all the arms will be covered in the network meta-analysis. Here you can see my progress. Right now, the full text selection is ongoing. We selected around 60% of the articles. Let's have a look at the number. We started by over 30,000 hits at the very beginning, and after duplication, close to 20,000 hits left. After the title abstract selection, we find 515 eligible studies, and right now the full text selection is ongoing. Let me tell you more about my second ongoing project. The title is Investigating the Safety and Effectiveness of Natural Herbal Oral Care Products in Caries Development. 47% of people around the world have untreated decayed teeth. Even in ancient times, people tried to do everything just to improve their oral health. What do they have? They had herbs around them, so they used herbs. We are much luckier than that, having gold standard tools in our arm, but again, I presented a lot of people develop fear of using fluoride, and the use of these gold standards are restricted. And people are drawn for natural herbal products. The statistics shows that herbal medications are currently used by about 80% of the world's population. People feel like going green, living toxin-free is safer and better for their overall health. And also the statistics shows, based on the numbers of the global market, that the natural and organic oral care products is growing and getting more and more popular. Which leads us to the question, can herbal oral care products significantly reduce caries development? We would investigate general population, herbal oral care products with or without fluoride, compare it to the gold standard or placebo. The primary outcome would be salivary streptococcus mutans and DMFT number. The secondary outcomes would be plaque index, gingival index, and safety. So my hypothesis is natural herbal oral care products are superior than standard of care related to caries development. To sum up, I have these 2 ongoing projects. Hopefully, I will finish by the first one till the end of this year, and I can finish by the second one by the beginning of next year. And I would like to thank for your attention, and I'd like to finish the presentation with one of my favorite quotes from the Apollo 13 moon landing mission: failure is not an option. Thank you for your attention.
Thank you very much, Katinka. We have questions here.
Thank you very much for this interesting presentation. My question is regarding the second project. When you say, or when you talk about herbal medication or options, what kind of plants do you have in mind? Was that listed in the articles, or what is used for this?
I had only a few plants in mind. Like if you go to a druggery and look around, you can count around 20 herbs. But if you open the endless book of literature, you will find 200. As in my mind, I was restricted to the European herbs. But then it's turned out that there are a lot more in South America or in India, so there is a really wide range of herbs from which people create herbal products.
maybe we don't even have those herbs in Hungary,
No,
right?
no, we don't. But we can find the products in the druggery, but only some of them.
Okay, and in what form would they be used? Is it a paste or is it a tea?
It's usually either toothpaste, either mouthwash, either tooth powder. But
okay.
In mouthwash form, these are the most common.
Mouthwash. Thank you very much.
Thank you.
Thank you for your presentation. I have a question regarding the first project. I guess probiotic products has a wide range, or they can differ a lot. And did you use any exclusion or inclusion criteria to select them, or not?
Not yet, but we are planning to create subgroups. As you mentioned, there are a lot of products, and these products usually include different strains. So some of them include only 1 or 2 strains, some of them is a mixture of strains, but hopefully we can create subgroups from them. But we didn't exclude any of them.
Thank you very much. Abel also has a question.
Thank you for the nice presentation. My question is, can you tell us more about the probiotics? How can we imagine this treatment? It is a short period of treatment or longer?
Yeah, sure. So probiotics can come from different forms. So you can take it via pills, for example, or there are products when probiotics is included in the mouthwash. Also, you can find toothpaste in which probiotics are included. Also, you can use them as a mouthwash if you mixture the powder of probiotics with some water. So there are really different forms. And fun facts for children to make probiotics more appealing, they add probiotics for food, for example, to cereal, orange juice, or even to chocolate or ice cream. So the range of using probiotics are really wide.
And if you are a risk patient, you should take probiotics forever, or how can we imagine this?
That's what we would investigate, how safe it is to use in a long term. Probably much comfortable to use probiotics compared to chlorhexidine mouthwash or even fluoride mouthwash. But in this article that we see, they usually take it for 2 weeks or take it for 3 months or take it for 1 year, and that's why we would like to investigate not only the short-term outcome by investigating the level of Streptococcus mutans count, but we would like to investigate the outcome of the long-term outcome, the DMFT number.
Thank you very much.
Thank you very much. We have time for one more question.
Thank you for your presentation. It was really nice. I have 2 questions, basically. But they were, so the first one is about the probiotics. So if some way, for example, with teledentistry or with normal dental examination, the patients got the diagnosis if, oh, you are a high-risk patient or you have a caries, but unfortunately I cannot treat you because there are urgent cases and the waiting times is too long, then probably regarding to your first project, you should give for that patient probiotics
Well, probiotics are mainly for prevention, so preventing the formation of the decay. I have no information if they can stop the remineralization process. There were some investigations that try to focus on the remineralization, if they are effective enough to stop or to slow. So I would only say that via teledentistry, you should use probiotic if there is a high caries risk patient. Based on the plaque level, you can tell that it's a high caries risk patient even via the cell camera, and you could advise to use probiotics to prevent the decay formation.
Thank you. And regarding to your second project, are you planning to do a clinical trial for herbal products or something? Because that's a very interesting topic. Yeah, and I was wondering if you could do with for example, with your PhD team or with the clinic.
It would be very interesting, and it would be kind of easy to run a project like this, because all we need is randomized patient and some intervention which is easy to access and very affordable, so would not be a very expensive extended study. So hopefully yes, in one time.